Hey guys, Davin Lim, dermatologist. Today's video is a video about comparing lasers versus microneedling, which is better, both bang for bucks, but also clinical efficacy. So as a background, I'm a dermatologist. I do procedural work and very little medical dermatology. So in comparing microneedling together with laser resurfacing, it's like asking this question, which is better, a hammer or a screwdriver? Guys, it depends on the job. So both of these are useful tools, but hopefully this video will give you a little insight about how we as dermatologists use both microneedling as well as lasers. So let's go straight into it. Microneedling, how does it work? Microneedling basically is an instrument which delivers needles, and the needles can be designed as a stamp, which is a stamper, something as simple as this from Banish, which is basically gold-plated titanium microneedles, which basically provides needle lengths of around 0.5 mil. So you can also have derma rollers. Derma rollers are very, very cheap. They're readily available. You can buy them from eBay for about $2 or even Alibaba for something like 50 cents. But high-end ones, for example, manufactured by SkinCeuticals, may cost $40, $50. Do they work? Yes, they do. They are more cumbersome to use. They're more tricky to use. And in my opinion, probably a stamper is the way to go compared to a roller. We still use rollers, but we're very careful. We need to provide traction and counter traction to the skin to make sure that the treatment is both safe but also effective. Now, the third thing which we can use is something called a derma pen or microneedling pen. This pen itself is powered by a motor, and basically you put an emollient or you put a gliding gel, and the motor itself delivers vertical microneedles to a predetermined depth. And that depth usually varies between 0.5 mil all the way up to 3 to 4 mil for the more advanced pen systems. Now, we talked about three. Those are the ones available through, I guess, home use. And the fourth one is basically RF microneedling. RF microneedling uses energy devices. Very, very different from microneedling. RF microneedling uses medically prescribed conical handpieces which basically fit onto a device, and what happens is that the needle penetrates the skin at usually predetermined depths, anywhere between 0.2 mil all the way up to about 5 to 6 mils. And then what it does is that it delivers a pulse of energy, which is basically radio frequency. Radio frequency heats the skin, generally speaking in the dermis, and what that does is to stimulate more collagen, repair scars that way. RF microneedling, totally different kettle of fish, because that is more costly and it's usually very powerful. So you need either sedation, and in many cases you do need a lot of local anesthetic. So that's microneedling for you, and that's where it sits. How does it work? So the first three, whether you're looking at stuff like stampers, rollers, or even pens, work by what's known as CIT or collagen induction therapy. CIT basically means to stimulate collagen, and generally speaking what happens is that when you penetrate the epidermis or the upper parts of your skin, you cause a cascade of reactions, and that cascade of reactions gives you what's known as growth factors. So growth factors, if you think about it, it's much like fertilizer. Once it's released from the top parts of your skin, fertilizes down below, which is your dermis, remodels scars, stimulates collagen, improves fine lines, improves fine wrinkles. So that is how microneedling that's non-energy based works. Lasers, well, it's really complex. So here's an overview. Lasers basically work on what's known as selective photothermolysis. In other words, it needs a target to hit. It causes a reaction based upon physics, and that gives an endpoint. So various targets, including water in your skin, including pigment, and including blood, which is basically hemoglobin. Once laser light hits that particular target, it causes a particular reaction. So there are many lasers that we use, everything from fractional lasers, which is more gentle compared to fully ablative lasers, and all the way to pigment lasers like pico lasers, Q-switch lasers, and vascular lasers to treat blood vessels and red skin. So you can see that there is some overlap, but when it comes to things, for example, like pigment, generally speaking, it's chalk and cheese. So when you're treating pigment, lasers are much, much better. If you're treating redness, lasers are infinitely better. If you're treating things like scarring, if you're treating things like, for example, fine lines, fine wrinkles. When it comes to microneedling, it can give you some results. But if you're using high-end lasers in the context of remodeling collagen and skin scarring, generally speaking, if you know what you're doing, lasers give you far superior results compared to microneedling. So we still use them because microneedling is a cost-effective way to treat mild acne scars. So certainly if you have more severe acne scars where it's deeper and we need to penetrate down to the dermal layer, stimulate collagen, with not only penetration of the actual laser itself, but the release of heat. Generally speaking, lasers are much better compared to microneedling. So in what situations are microneedling pretty good at? And here's my take on things. Certainly for mild stuff like what we talked about, mild scarring, mild changes, mild increase in pore size diameter, microneedling can be effective. When you're treating hair loss and you're using things like PRP, in my opinion, the use of microneedling together with PRP gives you a better result than what laser can, because laser, if you hit your hair with laser, even with ablative, non-ablative lasers, you're going to lose that hair temporarily. While microneedling does not produce heat, it does not target water, and hence you're not going to lose or decrease the amount of hair count temporarily. When it comes to hair loss, it's miles ahead. When it comes to speed, I'm much quicker with a microneedling device compared to a laser. The reason being is that with laser, you've got your preset, you've got to warm it up, you've got to turn it on, you've got to set it all up. When you go deep, you need a lot of local anesthetic. So with microneedling, it's basically, you just set it up and bang, you're ready to go. And within a few minutes, you complete the treatment. Secondly, when it comes to dermal drug delivery, microneedling is a very effective way of delivering drugs. So in my practice, what I use microneedling for is to deliver certain topical drugs, for example, steroids, where I want to treat things like hypertrophic scars or keloid scarring or papular type of acne scars. That's when I use microneedling. Once again, because it's cost effective, it's quick, and it's also effective. So guys, that's a quick overview on microneedling and laser resurfacing. When you see your skincare expert, I guess you have a better understanding of what is best, because if you see someone who's got microneedling devices, they're going to treat everything with microneedling, whether it be your stretch marks, whether it be your pigment, your acne scarring, your wrinkles, the whole lot. When you have someone with lasers and they're focused to pay off that laser because of the business loan, everything that you ask for will be a laser treatment. So it's very important that you find a provider who can give you that balance, who can give you that advantages of using microneedling for certain conditions and the advantages of using laser resurfacing. And based upon your concerns, your goals, your expectations, your downtime, and obviously your budget, your skincare expert, your dermatologist can guide you as to which treatment is best for you. I hope you find that lecture useful. Please like, comment, share, and subscribe.